Good evening, everyone, and thank you for joining us for tonight's webinar, Skin Pen Precision, a Busy Practitioner's Perspective. My name is Angela McDonald, and I am the Senior Director of Education for Crown Aesthetics. I will be moderating tonight's broadcast. Our webinar is scheduled for 1 hour and will include an interesting perspective from a highly successful medical aesthetic practitioner and skin pen provider. Before we can begin, a few housekeeping notes. During the webinar, all lines will be muted to avoid any background noise. If you'd like to ask a question, you can do so at any time during the presentation through the question box at the bottom right-hand side of your window. We will proceed with Q&A immediately following the presentation, so feel free to submit your questions anytime. So let's get started. Crown Aesthetics is delighted to introduce you to Emily Frost, registered nurse, licensed esthetician, and certified laser technician. Unfortunately, I have to share with you this evening that we're having some technical difficulties, so we will not be able to see Emily's beautiful face live, but you will fortunately get to see some pictures of her throughout the presentation. Emily is the owner of Frost Aesthetics in Mesa, Arizona. She believes that self-confidence is key, and she feels by enhancing her patient's skin health, she is not only enhancing her patient's appearance, but their overall life and relationships as well. So with that, Emily, the floor is yours.
Thank you so much. I'm so excited to talk to you guys tonight about the skin pen. It is definitely one of the most popular treatments in my practice. So a little bit about me. I have over 5 years of clinical experience specializing in cosmetic, facial, and body rejuvenation. I started out my aesthetic career working for a board-certified plastic surgeon for just over 3 years. While I was working for him, I assisted all of his injections, and it inspired me to go back to nursing school so that I could provide more services and have a broader scope of practice. So I kept doing aesthetics all through nursing school, and then I opened Frost Aesthetics in Mesa, Arizona, February of 2020. And I am very, very excited to be a skin pen ambassador. There are 3 different providers in my practice, including myself, that perform skin pen treatments, and we just love it. So I think you guys will understand why it's become one of our most popular treatments as we get on with this webinar. So we're going to go over some objectives. Tonight we're going to go over skin pen microneedling, why you could all benefit from having it in your practice, how it works, the difference between radio frequency microneedling and skin pen, how to maximize profits, and how to effectively perform a treatment in just 30 minutes. All right, so first I wanted to start out with why I chose skin pen over other devices. I've used multiple microneedling devices in my career, including 2 other FDA cleared pens, and the results and experience I had with the skin pen were on another level. So honestly, I just put skin pen in its own category. I first decided to demo the device because I had patients calling in and asking for skin pen treatments by name. After demoing the device, I quickly realized why, because it was a much more powerful and pleasant treatment. The needles stayed sharp through my entire treatment, even when I was treating multiple areas, and I never experienced any skin tugging or concerns of if my needles were penetrating to the depths that they were set at. And that was like my first time ever using a device where I was like, okay, holy crap, this is like the Rolls-Royce Lamborghini of microneedling pens. Now moving into who is a good skin pen candidate. So legit, you guys, almost everyone. I always tell my providers, as long as the patient is not pregnant, breastfeeding, doesn't have active acne, or some type of a serious blood disorder, they are a skin pen candidate. So we recommend skin pen and include it in everyone's treatment plans, and end up doing somewhere between 3 to 5 skin pen treatments per day, strictly honestly because of its versatility and ability to address so many different skin concerns all at once. So I definitely wanted to hit on the skin pen's mechanism of action. I want to talk a little bit about how skin pen actually works. So the skin pen microneedling is essentially a way to trigger the body's natural wound healing cascade by creating a controlled injury to the skin. 14 stainless steel medical grade microneedles penetrate the skin millions and millions of times, creating an injury and inflammation. So this injury then leads to tissue proliferation and remodeling. So simply put, a skin pen treatment forces your body into neocollagenesis, which is where you grow new collagen and elastin fibers. This collagen cascade results in smoother, younger, healthier, more vibrant, glowing, and overall just beautiful, healthy skin. And then another thing that I definitely wanted to hit on is a non-inflammatory pathway versus an inflammatory pathway. And this is where microneedling with radiofrequency and skin pen treatments often can get compared and confused. Like I feel like both patients and providers, especially because I know a lot of practices are offering both, get confused on when they should use one or the other. So just keeping in mind, the skin pen uses a non-inflammatory pathway. So it offers little downtime and utilizes your body's own growth factors. It's safe for all Fitzpatrick's types, so 1 through 6. And what I really, really loved is that there hasn't been any cases of post-inflammatory hyperpigmentation observed in skin pen's clinical studies. On the other hand, microneedling with radiofrequency uses the inflammatory pathway, which you guys, I have a microneedling with radiofrequency device and I love it. But where I really feel like microneedling with radiofrequency shines is in skin tightening. Where the skin pen shines and is my choice 10 out of 10 is when it comes to acne, scarring, and wrinkles because of its regenerative healing benefits. So this is my beautiful patient after 3 skin pen treatments. Okay, you guys, it is pretty unreal to me that I had done several different lasers on her face. We'd done chemical peels. We did do microneedling with RF prior to her before photo, and skin pen was the treatment that was able to create this dramatic result. So with skin pen, she experienced less downtime and more significant visual changes. I really, really have felt like this came down to me trying a different pathway with her skin and mechanically breaking down her scar tissue to remodel it. And it also increased her blood flow to allow her skin's natural growth factors to do the work for me. So truthfully, seeing this transformation take place was a pivotal moment for both me and my other providers and has drastically changed the way my practice treats acne scarring. So the skin pen's precision is unreal. It is the first FDA cleared microneedling device and only FDA cleared microneedling procedure and is engineered and manufactured in the USA. It's been proven safe and effective through 2 clinical trials and over 90 FDA validation studies. So what I love is whether you're treating thick scar tissue or aged thin skin, Skin Pen maintains its high power, delivering 1,600 controlled micro injuries to the skin per second. 1,600 controlled micro injuries to the skin per second. Holy cow. Okay. So this is so important to me because it ensures a predictable response for all patient types. I love that the skin pen is cordless and I don't have to worry about keeping a dirty cord away from my patient's treatment treatment area, usually their face. The charger is honestly convenient too because we always know where our skin pens are. So we have 2 in my practice, and it's a rule in my practice that the providers place the skin pen on its inductive charger base after every single use so that we're starting every procedure with a full charge and we never have to worry about losing battery power mid-procedure. What's nice is that there's 3 little lights on the device that communicate battery level. And they also will communicate to you through flashing lights if your device is not working within its tolerances. So you're able to rest assured that you'll never have to worry about treating patients with a device that is not 100% fully optimized. And then the tip, you guys, these cartridges are gold. In my opinion, they're definitely one of the key factors that make the skin pen so unique. So they have 14 medical grade stainless steel needles that have been validated to keep their same sharpness for at least 80 minutes in use on scar tissue. So I love that they did that study on the actual scar tissue and not just some like thin, easy breezy skin. So keeping same sharpness for 80 minutes on deep scar tissue, because I feel like a lot of the times when we're microneedling, we're doing it on scars. So this is why you'll never experience tugging from dull needles. And then you'll also never have to waste time and money switching your needles out mid-treatment, or to add on additional areas. You'll never have to worry like, okay, am I doing too large of an area? Can my needles handle this? You can rest assured that they absolutely can. And then also with the needles keeping their sharpness, it's also going to ensure that your needles are actually penetrating to the depths that they say they are, because your device is not losing power and it's not losing the sharpness to where they get dull and actually can't penetrate as deep or effectively. So the final thing that I love about the tips is that they eliminate my practice's risk of cross contamination, which I know there's been like a lot of that in the industry. The tips don't allow any blood, fluid, or serum to pass from the needle cartridge to the handpiece. And they also have a single-use lockout feature. So we don't ever have to worry about who's like flipping the room or who's trying to help out, because if the needle has been used, a little silver thing kind of pops out, and my people who are helping clean the room know like, okay, yes, Emily did use this pen, or this other provider used this pen, and they know to dispose of it. This is the beautiful skin pen kit, which I really love because it just keeps us organized. I love the kit also because it ensures that my treatment protocol is just standardized across the board with every single patient and every single provider. I definitely feel like it helps optimize my patients' safety and their treatment efficacy. And it also ensures that every single patient leaves my office with a plan for post-care. So they're leaving the office. Keep in mind, our patients after any type of microneedling treatment, whether that's skin pen, different devices, radio frequency, they're leaving your practice with compromised skin and open microchannels. So the fact that you already have a kit and instructions that ensures safety and tells them exactly what to do is just super comforting. Here is a gorgeous before and after of the neck. So really look at the improvement of the wrinkles that was achieved. It's a pretty amazing result, and it's a great visual of why I always recommend adding in the neck to facial treatments. It not only adds an additional, like it's literally 5 to 10 minutes of treatment time. So it not only just adds a couple minutes, but it also increases your revenue by roughly $100 to $200, just depending on what you're charging for that add-on area. And I think it's really important too to hit on that result that they had in their studies, that 94% of patients noticed an improvement in their wrinkles. That's a very, very high satisfaction rate. Okay, so how to maximize skin pen profits. As you can see, the treatment margins are incredible. So in my practice, what we've found is that treating larger treatment areas results in a better outcome overall for the patient. And then this then leads to a higher patient satisfaction and ultimately, honestly, a higher revenue for the practice. So with the needles proven to remain sharp and us having in that treatment kit a full ½ ounce of glide gel, the treatment cost remains the same, but the revenue opportunity increases dramatically when you expand and you get into treating multiple areas. So I just really, I know I keep hitting on it, but it's like the fact that the needles are able to stay so sharp, you're not having to waste consumable costs, and you're able to create that many micro channels in such a short amount of time. You get through the treatment quicker, and so you're utilizing your time, which that kind of is what will lead us into this next slide. Skin pen, face and neck in 30 minutes. So time is money, you guys. We don't want to waste it. Talking about treatment margins like we just did is important to calculate overhead, but what I think is even more beneficial is how quickly you can perform the treatment because the skin pen delivers 3 million microchannels in 30 minutes. So we're getting 3 million microchannels in 30 minutes. Before I had the skin pen, you guys, I was used to always doing microneedling with RF, which even if you're doing 1,000 shots, which takes probably 40-ish minutes, you're only at 36,000 microchannels. So the fact that we're hitting 3 million is just incredible to me. I am very busy, so I'm always trying to utilize my time as much as possible. So for me, whether that's delegating numbing to another provider so that my patient could get numbing while I'm up in another room finishing another patient, or making sure that I spend the time that the patient is numbing explaining post-treatment instructions so that when they're done, they're like truly done and can just peace out from the office. It's just really making sure in your everyday life in practice that you're being as efficient as possible because improved efficiency yields increased profits. And so overall, that's how you're going to be the most successful. So that's just another way that I feel like the skin pen microneedling system truly sets you up for success. I wanted to recap all of the skin pen benefits. I know we've gone over a lot. So here's just a short little recap of why every single one of you could benefit from a skin pen in your practice. First of all, it's backed by over 90 FDA validation studies. It's safe for all Fitzpatrick types and can be done 12 months out of the year. So I live in a sunny state. I'm in Arizona. So I know that like those summer months, people struggle and we can't really do laser. So that's when I love that I can just continue on with all my skin pen treatments. It makes it super nice. I love that it's a natural way to stimulate collagen and elastin, and then that the treatment is quick and it's easy, very easy to teach as well. So it truly is just overall a great value for you and your patient. It's just a win-win across the board. Now, okay, this is freaking legit. At first, I didn't even really care about this because I didn't actually think it was going to do anything, but it did. So this is something that Crown Aesthetics does that I think is super beneficial because I've actually had patients call and schedule from finding my practice on their locator tool. So I saw a statistic and it said medical aesthetic statistics suggest that each new patient is worth $22,000 to a practice in their lifetime. So me personally, it just makes me feel super valued to see Crown Aesthetics spending money on direct to consumer advertising to benefit their partners. So yeah, 250,000 visits since 2019. And I'm not surprised because I've received probably, I'm not even joking you, like 20-ish leads just from this locator. So that's been so helpful. And then I know this is about skin pen, but I also do have ProGen PRP in my practice. And I wanted to touch on it just because I was blown away when I first switched over that I could visually see the difference in how rich their PRP is. And then I also saw a recent white paper that showed that their 30 ml tubes get up to 6 times concentration and a 90% platelet recovery. So it's just a great addition to add in with skin pen. So we are going to wrap up with some questions.
Thank you, Emily. That was fantastic. I believe there's one more slide, actually. We can see your pretty face since we don't get to see it on camera tonight. But thank you for that. We've got, chat room is lighting up. We've got a lot of great questions. So, there were quite a few questions around the patient that you shared, your acne scar patient. Can you talk a little bit about your treatment protocol for that particular patient, and in particular, what depth you used?
Yes, so for that particular patient, that was before and after 3 treatments, and we spaced her treatments about 6 weeks apart. Treatment depth around the forehead, the under eyes, the nose, and the upper lip, we were at 0.25. On the chin, I was at 0.5 millimeters. And those areas, we did about 4 passes. And then on her cheeks, I was at 1 millimeter and I did about 6 passes. But what is so nice with the skin pen is that we did complete those treatments in 30 minutes. And that's where I really feel like it's shining, that I'm able to get that drastic of a result. Also, the patient like verbalized to me, she was actually really excited. I reached out to her yesterday and asked on behalf of Crown Aesthetics if we could use her before and after. And she sent me this super nice text and she was like, Emily, honestly, I had almost given up on my skin because we had tried so many different things. And like, I have really amazing devices in my practice. um, I hadn't seen her for a couple of months and then I got my skin pen and I was like, you know what, like I know we've tried microneedling in the past, but you're just gonna have to trust me. This pen is different. And she put her trust in me. And she just like kept thanking me for introducing her to skin pen and allowing her to receive those treatments. So yeah, just 3 treatments. The downtime was super minimal. So she did leave my practice the day of treatment with pinpoint bleeding on her face. I have my patients leave the pinpoint bleeding on their face for 3 hours. They then rinse with room temperature water and they will then put on the serum that comes in the recovery kit. So that's another thing that's nice, is that she's able to return to work the very next day without the massive downtime and the swelling and the scabbing and the bleeding and all of that.
That's, exactly what we've heard over the years. A couple of things, Emily, in terms of acne scar patients. I mean, what better, opportunity can you give these patients, but to give them just what you just said, a no downtime, cost effective, comfortable procedure that can have such dramatic results on something that they've potentially lived with for a very long time and have given up on. And that's a common theme that we've heard over the years, as patients have been treated with skin pen. I also love the depth. I think that's a really great point. You might have heard Emily say in the presentation that Skin Pen Precision is the only microneedling pen that's actually validated to achieve the depth at which you set the device, whether that is at 0.25 or 2.5. So it really gives practitioners the confidence that when they're setting the device on a depth, that it's actually getting to that depth. If they're trying to go deeper or if they're trying to remain more shallow, that they're actually achieving those shallow depths. So I bet a lot of people are surprised, Emily, that 0.25 on the forehead. I believe you said 0.5 on the chin, and then she uses 1 millimeter on the cheek. But keep in mind, again, we're validated to achieve those depths. And anytime you're working in the bony areas, you can work at lower depths when bone is opposing those needles. Anything else you'd like to say in terms of treatment of acne scar patients, Emily?
Yes, I do want to add on, you guys, because I know that those depths seem so shallow. The devices I was using previously to get the same endpoint, I was at on the cheeks. I would literally crank my previous devices up as high as they could go. So we're looking at like 2 and 2.5 millimeters to even get pinpoint bleeding with other devices I've used on the forehead. I would have to be at least 1 millimeter, which if you look at research and the actual depths of the skin, you know that being at 1 millimeter on the forehead, you should not have to be that deep before you're seeing the pinpoint bleeding. So to me, like I remember doing my demo and my rep, she's amazing. Jessica was like, okay, we're just going to start at 0.25. And I like looked at her and I'm like, are you serious right now? Like, there's no way. She's like, what do you normally treat at? And I'm like, I'm at least 1 millimeter. And she like kind of laughed and I'm like, no, I'm like serious. Because I mean, I try to take the most overall best approach that I can, but I was like, I'm having to go to those depths. And I also think that's one of the reasons why we experience so much tugging with other devices, not to knock on them, but it's just because the needles are literally getting stuck and they're not actually going as deep as you're thinking. So if you're currently using a device where you're going up to 2 millimeters just to get pinpoint bleeding and 1 millimeter on the forehead, I would kind of question whether or not you're actually at that depth. Because if you look at the science and you're not seeing anything, I mean, I would just be a little bit concerned.
Myself, it is something that we saw in our generation. This is our fourth generation pen. So we had other devices prior to building the device that you have today. This is our intellectual property that we actually built. Having all of the experience with those other technologies that we were sourcing from existing manufacturers previously showed us exactly that, Emily. That you would see over time that the depth would actually slip. So as the device wore down, the depths would change, the calibration would change. And so as we built SkinPen Precision and engineered this device, we wanted to make sure that didn't happen. It's one of the reasons we went through over 90 validation studies to prove this device works just as we say it does. So glad that you're clinically seeing that in practice. Let's talk about treatment of neck now, because you talked about the opportunity that you have in your practice of not only getting a better result and overall and improving patient satisfaction by treating both face and neck, but talk a little bit about the treatment protocol for those patients. Emily, what needle depth, for instance, do you typically use on the neck, and how many passes and so forth?
Yeah, so typically on the neck, I'm around 1 millimeter, 1 to 1.5. It really depends on the patient's skin and how thick it is. And that's same with on the face. I will do around 3 to 4 passes, but like I was mentioning earlier, it really only adds about 5 to 10 minutes, depending how large the patient's neck is. But like day of treatment, I think it's kind of important to go over day of treatment, like what I do. So typically day of treatment, the patient will walk into the practice. We obviously make sure consent and everything are signed. They know what they're doing. They'll then come into the treatment room. We'll cleanse and prep their skin. We will apply that BLT numbing to their skin. They'll numb for about 15-20 minutes. We then remove the numbing. We'll wipe them down with alcohol, make sure that we have a perfect surface, apply the glide to their face and neck. That's another thing I love about the glide, is that it doesn't dry out. Previously, when we were doing face and neck, I'd have to like just section off where I'm putting the glide, but I really feel like I can put glide on the entire face and get the entire face done, and then put glide on the neck and get the neck done. So we're moving straight from face to neck. So I typically will start out on the forehead. I'll do forehead, then I'll move to the under eye, then I'll do the nose, then we go to upper lip, chin, cheeks, and then after the cheeks, we'll go directly to the neck. And I also will do same amount of treatments. Really with SkinPen, it's anywhere from 3 to 6 treatments. It really just depends on how well the patient's body responds and what type of an outcome they're hoping to achieve.
Very nice. Thank you, Emily. We're looking at some of the questions coming in through the question area, everyone, and just be aware that we will need to stay on label with tonight's presentation. SkinPen Precision is FDA cleared for treatment of acne scars in patients 22 years and older in Fitzpatrick 1 through 6, and also for treatment of neck wrinkles in Fitzpatrick 1 through 4. So we'll need to stay within that labeling. If you have questions for use of SkinPen beyond those 2 indications, then we would ask that you would contact our medical affairs department at medinfo@crownaesthetics.com, and they will be able to provide answers to those questions. Unfortunately, we won't be able to cover them here. So let's talk a little bit about endpoint. We've gotten several questions, Emily, about what you consider the appropriate endpoint for your acne scar patients or your neck wrinkle patients. What are you looking to achieve? Are you looking for erythema? Are you looking for pinpoint bleeding? In both of those cases, what is your endpoint?
Yeah, so I would say a vast majority of the time we are getting the erythema and the pinpoint bleeding. I will say a lot of that does depend on the patient's lifestyle and their medical histories. Keep in mind, if your patients are taking things like fish oil, aspirin, any NSAIDs, blood thinners, things like that, they are gonna reach that pinpoint bleeding a lot quicker. But I would say around like 99% of my patients for sure, actually 100% at least have the bit of pinkness to their skin, and like over 90% of them do have that pinpoint bleeding. So I really am just looking to see that their skin is reacting to the treatment, which I've never had someone not react, especially because we are getting so many different little channels in their skin. But medical history definitely takes a role in that. I'm never looking to achieve, like, I feel like sometimes you'll see on social media or online, like literal, like dripping skin, just oozed in blood, like that Kim Kardashian photo a lot of us have seen. I am not continuously needling over and over and over because you just don't need to. You're going to get an incredible result. And I do believe that a lot of times less is more. So I would not suggest just microneedling till you're seeing like a ton of pinpoint bleeding. I know some patients think that that's what they need in order to get results, but with this device, that's just not the case. And with how precise the needles are and how they're not tugging and tearing tissue, I do think that you have less downtime with this device, yet you still are getting more optimal outcomes.
Well, and it's one of the reasons we called the device or named the device Skin Pin Precision because it does work so precisely. And one of the benefits, as Emily touched on, of working with Crown Aesthetics is the education that we provide around the device. So when you become a partner of ours, and we've got a lot of questions that are kind of around this right now in the question area, you will get access to not only our e-learning, where you'll go through different modules that'll help provide some of the background information for microneedling, but you'll also have the advantage of having one of our local territory managers come into your practice and provide hands-on training. We're very, happy to say that as a microneedling and PRP company, we do have a direct sales force. We are about 60 reps strong nationwide at this time, planning to go to 70 later this year to make sure that our team continues to have the bandwidth to service our customers long term. So that is a commitment that we have to our practices. I will share with you too, we have a lot of resources. This is one of our marketing resources. It's called the Skin Pin Treatment Trainer Tool. All of our customers can access this digitally through our marketing portal on crownaesthetics.com. And you'll see that we provide information like this that will show you, based on a study of where you're working on the face or neck, you'll know the typical skin depth in that area so you can base what depth you go to with the device accordingly. And again, part of the value of working with Skin Pin Precision is that it's actually validated to achieve those depths. So resources such as this that tell you skin depth aren't necessarily valuable unless you've got a device that can actually, you're confident that can you get you to those different depths. So Emily, one of the things you touched on in your presentation was RF. And I think you made a really good point that sometimes RF, because it's being delivered by microneedles, is often confused with the process of microneedling or skin pinning, we like to call it. So can you touch on a little bit more about when you choose one of those versus the other?
Yeah, absolutely. I would love to. So skin pen and like skin penning, that I choose that for my patients that have acne scarring, PIH, textural concerns, things where you look at the skin and you're like, okay, visually we need things to be smoother, we need a brighter, we need an overall clearer, brighter complexion with less texture and acne scarring. That's when I'm going to go to my skin pen. If a patient comes in and they have a lot of laxity, like just general skin laxity, I think microneedling with RF, because truly it is a radio frequency skin tightening treatment. Like I mentioned earlier, a lot of the devices, the device that I have, which I still love it, it has 36 medical grade needles at the tip of it. However, even if I'm doing 1,000 pulses, which that is a very aggressive treatment, we are only achieving 36,000 micro injuries. The main reason for that device is the radio frequency getting into that dermis and creating skin tightening. When we're looking at the skin pen, so kind of in your brain think, okay, if a patient comes in and they just have lax skin, like they literally pick, I wish you guys could see me, you've probably seen your patients pull up their cheeks and push them back and be like, I just want my skin tight like this. That's when I will do microneedling with the radio frequency. And I will say a lot of the times those patients also have wrinkles, and I will also incorporate skin penning into their treatment plan. So if a patient comes, they just have some wrinkles, they have textural concerns, that's when I'm going to do my skin penning treatments. So does that make sense? Did I make that clear enough, Angela?
Yeah, and I think that's kind of how we position it as well. We don't consider these two devices mutually exclusive, quite honestly. There's a place for both in every practice. And with skin pen, as you saw in Emily's presentation, because the procedure doesn't follow a non-inflammatory pathway, we're not using heat, we're not using chemicals. So we're not creating fibrotic tissue under the skin. Fibrotic tissue is when you get contraction or tightening of the skin. You're getting that with an RF device. You're not getting it with skin pen. So I think that, I hope that, and if there's more questions around that, please, and go ahead and put those in the question area now, and we can further dive into that. But I think that should have answered some of the questions that we've had thus far, Emily. And
Awesome.
talk about your maintenance therapy. So we've gotten quite a few questions. I think you mentioned with your acne scar patient in particular that you did 3 procedures in that particular patient. Do you normally do 3? Do you go to 6? And then do you bring that patient back? And then talk about your neck wrinkle patient in the same respect, please, Emily.
Yes. So that patient that I showed the photo of, that was before and after 3 treatments. Since that after photo, she has actually received an additional treatment. So we are now at 4 treatments because she's hoping for like 100% smoothness. She wants to be able to wear absolutely nothing and have flawless skin. So on her, I mean, I think after 3, she had a beautiful clinical outcome. But like I said, the patients optimal outcome, what they're wanting to see could be different than what we think is their final outcome. So for her, she wants like that glass skin. So we are going to go for 6 treatments with her. We space them all 4 to 6 weeks apart, just depending on the schedule and everything. But most of the time, I mean, it really varies on what the patient's expected outcomes are. I think you see noticeable results even after just 1 treatment. But my practice in particular, we typically sell a package of 3 skin pen treatments, which we space 4 to 6 weeks apart, no matter what area of the body we're doing it on. And then um, after that maintenance therapy, a lot of my patients honestly just love the skin pen so much that they're getting it once a quarter. But I do believe I've read studies where it says that your body will continue to produce collagen for even 6 months after a treatment like this. So I will tell my patients that like maintenance, I would say every 4 months, every 6 months. It kind of is like a lot of the times I will compare treatments to like diet and exercise. So if you're doing good things all the time, like you're eating healthy foods all the time, you can get away with having to do less treatments all the time. And like and I compare the treatments to like going to the gym. If you stay up on everything, you're going to keep looking great, you're going to feel great. So if you're keeping up on your treatments, you're going to keep thinking your skin's looking great, it's going to feel great. But yeah, I think even if you had a maintenance program where afterwards your patients are just coming in 3 to 4 times a year, that would be incredible.
Okay, thank you, Emily. I appreciate that information. I've gotten quite a few questions on indications. I read you the indication in terms of wrinkles of the neck in Fitzpatrick's 2 through 4, and then improvements in acne scars in adults age 22 and up, and that's in all Fitzpatrick types. Keep in mind that the indications that a company receives is based on how they design their clinical study. So because in acne scar patients, we had already proven to be safe in Fitzpatrick 1 through 6, we didn't feel the need when we did our additional studies to study all patient types. Likewise, if in our acne scar study, we only went to a depth of 1.5 millimeters on the face, because typically if you look at studies that show on skin thickness, the skin isn't normally thicker than 1.5 millimeters on the face and is consistent with age, gender, ethnicity, and so forth. So we'd already proven that we were safe in Fitzpatrick 1 through 6, but we had not proven yet that we were safe to a depth of 2.5 millimeters. So in our wrinkle study, we actually went to depths of 2.5 to show that we were safe and effective even at those depths. So just a little bit of information, don't when you look at the indications as to how those indications come about, it's really just based on how we designed our study. So we're getting quite a few questions, Emily, and I'm gonna preface this statement by saying that PRP is not indicated for medical aesthetics. There is not a PRP brand that is. This is all off-label use. So tonight we're not going to talk about specific patient types in which you would use PRP or what products you might use PRP in combination with. But we are getting some questions, Emily, just on your thoughts about ProGen PRP in particular. And I believe when we've talked previously, you said you used some other PRP systems. And so what made you come to ProGen Advantage PRP in particular?
Truthfully, ProGen PRP in particular was because it was from Crown Aesthetics, because I was already blown away with the skin pen. And I'm like, holy crap, if a company's going to put out a microneedling device like this, I would imagine that they would also put that much effort and energy into the other things that they were releasing. And I also had an incredible relationship with my rep. She was amazing and I loved working with her. So it just was kind of an easy and really convenient transition for me to try it, because I'm like very strict about what I will and won't try. So I was like, okay, I guess that I will test this out. Once I tested it out and after we got this spin speed, and like I pulled it from my centrifuge and I saw how much darker and richer the actual PRP was, I was like, okay, like there's a visible difference. Whereas with all the other kits, I honestly, I felt like they were all the same. Like I'm like, okay, whatever, this sounds terrible, but I'm like, whatever tube is going to be the cheapest for me, like whether that was one or the other, there's two really popular companies. And I'm like, okay, this tube's $10 cheaper. I think they literally yield the exact same PRP results and outcomes. So I'm going to go with the cheaper tube. But and funny enough, ProGen actually is cheaper, but it's way better. So then when I saw that, I was like, okay, wow, like this is financially smarter for my practice and it's way richer, clearly just visibly. And then reading those white papers, it just confirmed that, okay, like even to my naked human eye, down to a molecular level, it just overall is a better product. And it's super easy to use. Like the kits, they put together their kits similar to how they do with the skin pen kits, where like everything is just right there to where like I know I open up my kit and I have literally every single thing I need from beginning to end. So even from alcoholing off my patient's skin to do the blood draw all the way to cleaning up. So you just have everything that you need. It's at an incredible price point and it just is very effective.
Thank you, Emily. And it is something that we have strived for the last 8.5 years since we've been on the market as a company and as a skin pen device, and then adding to our portfolio was, creating products that allowed practices to differentiate themselves in a very crowded market. So always focused on quality, always focused on the science and the education and the support that we brought into those behind those products. It's one of the reasons that our entire portfolio is now US engineered and manufactured. It allows us to maintain that quality commitment, but also maintain our inventory properly as well. So we don't have issues with stockouts of not being able to supply customers because all of our products are US manufactured. So I'm glad that that's translating and you're seeing it from a practitioner level, that all of the time and effort and energy that's put into making sure that we provide the highest value to our customers. So we are getting some questions in terms of seeing results. And I think you kind of touched on this on one of the previous questions, Emily, was, if you look at the wound healing cascade in a timeline, you can keep seeing changes in the skin up to actually a year after a single injury, in our case, controlled micro injuries with a microneedling device. But from a practitioner standpoint, from what you're seeing in your before and after pictures into the naked eye in practice, when would you suggest that patients start seeing results from skin pen? And then when would they potentially see the maximum result?
So I always tell people you may not love your skin the first week after treatment because you could be a little bit dry, a little bit flaky, depending what was lying on top of your epidermis. If you had some dead skin cells, that's going to kind of flake off because it is very exfoliating as well. But I feel like people start to get a gorgeous glow to their skin even just 1 week after treatment. Me personally, I feel like 2 to 4 weeks after treatment, and that's a majority of my patients will get just this gorgeous glow to their skin. But as far as seeing textural changes with acne scarring and wrinkles, it does take your body typically around 4 to 6 weeks to really produce enough collagen to where you're like, okay, wow, yes. So that's why, like, I'll even tell people, okay, you think you love your skin after this first treatment, you're going to love it even more after the second one, because after the second treatment, say I space their second treatment 4 to 6 weeks, once they heal from their second treatment, that's really when the first treatment's collagen and elastin and everything is kicking in beautifully. So I would say roughly, depending on the patient's age and their health history and all of that, 4 to 6 weeks. And I think they still see improvements up to like 4 to 6 months after their treatment. So it is kind of variable depending on the person, but beautiful glow to the skin, like I said, about a week after, textural changes, wrinkle changes, things like that, about 4 to 6 weeks, and then optimal outcome closer to that, maybe 3, 4, 5, 6 month mark.
Well, and I think it goes back to that slide that you showed earlier, Emily, on how SkinPen follows a non-inflammatory pathway to results versus some other modalities that are that are available in most medical aesthetic practices that use heat or chemicals. And it really does allow for that the growth factors. Just by needling the skin, you stimulate the skin's natural growth factors, which you're exactly right. That's where the glow comes from. But it's the exciting results when we see an increase in collagen and elastin later on that you see the more long-term results as well. So I'm glad to hear that the studies are really matching up with what you're seeing in clinical practice as well. So let's talk about, and we did get a request that people wanted to see the before and after pictures again. So we put those back up for you as well. You talked about your post protocol, and this is something that information we provide in our training in terms of what do the studies show us in terms of microchannels and how long they stay open. What does that look like when a patient leaves your practice, Emily? You finish their procedure and now you're sending them out the door. What is the conversation you have with them about how they're to treat their skin in the next 48 hours and maybe even that next week as well?
Yeah, so post-treatment, my instructions to my patients are, I tell them, I want you to treat your skin as if it's an open wound for the next 3 to 4 hours. I know that it doesn't feel like it, and even once you rinse the pinpoint bleeding off your face in a couple hours, you might feel like you just have a mild sunburn and you want to throw makeup on and you want to just book it out the door and you feel like there's no wound at all. Really keep in mind that your skin is an open wound. So like wash your hands a lot for sure. Fresh pillowcase that night. Any animals, keep them away from your face. I don't have my patients put anything besides that serum on their skin for the next 24 hours. Heaven forbid they have to go to work the next day. They absolutely could put on like a mineral sunscreen. I don't like my patients to use retinols or any really active exfoliating products for a minimum of 5 to 7 days, just to allow their skin and body to like really fully heal. So that is something that I do love, though, is the minimal downtime and how quickly people do heal, that they're like, oh my gosh, like there's no wound here, I'm good to go. Like it's nice that visually it looks like that, but it's really just training your patients and kind of hitting it home with post care, which is something I love that it's included in the kit, that, hey, you know what? There are millions of microscopic little wounds in your skin, so you really need to treat it that way.
And we did get some questions actually on number of microchannels. So, this is a good lead into that. SkinPen Precision is validated to attain 1,600 microchannels per second. So I think you heard Emily say in her presentation, if she's, limiting her procedure to 30 minutes, if you do a 30-minute procedure on the face, that's almost 3 million microchannels in that 30-minute period. So if you consider the fact that around every tiny microchannel, there's a small sphere of remodeling that occurs. We want that really thorough coverage and that consistent coverage across the skin so that you get a really nice even remodeling of the skin. And of course, that remodeling includes deposition of new collagen and elastin. So, that's the microchannels, as she mentioned, the studies show those microchannels that are created during the procedure can stay open up to 24 hours post-procedure. They do start closing quickly, and Emily's exactly right. The studies show that 4 hours is kind of an interesting mark where the skin can return to some normal permeability, but there can still be channels open up to 24 hours. And that's why we recommend that you just stick with the Lift HG that comes in the kit while channels are open, because that's the only product in the world that's actually been FDA cleared for open microchannels. So we know it's safe. It's going to provide a little moisture. It's going to provide a little barrier, and we know it's safe first and foremost for your patients. So anything that you'd like to add to that, to those comments, Emily?
I feel like a good way to just get your patients also to understand that is I like tell them, I always go back to the fitness stuff because I feel like a lot of women or men who care about their skin, they're also into health, beauty, lifestyle, all of that. So I'll say, like, you got to remember it's kind of like a muscle. If you work it out, we just worked your skin out super hard. So you want to let it heal, like let your skin recover, just like you would let your muscle recover. You're not just going to continuously keep breaking it down, breaking it down. And that's what they would be doing if they were putting something like a retinol or another product on their skin that soon after the treatment. So we're just letting it kind of fully heal itself. Like, get your max benefit before you're going to go crazy and put all these other things on top. Because you really could just increase, I mean, you could cause PIH by putting, using other things way too soon. So just really getting them to understand what's going on a scientific level as well, but kind of dumbing it down for them has helped me a ton, just with not ever having any issues post-treatment. And that is one of the things that I do love about this treatment, is that I don't worry about my skin pen patients, because everything they have is at their fingertips. It's very easy post-care. They know exactly what they're doing. There's nothing to question. And same with my providers. Like, anytime there's a patient back and I know they're getting a skin pen treatment, I'm not feeling like I need to ever pop in the room and like, hey, let's make sure they don't have too much sun exposure on their face. Let's make sure that they've stopped things prior. Like, it just is easy. It's an easy transition from the moment they walk into the office to the moment they're walking out and when they return for another treatment. So it just, that has helped me a ton, because I do feel like we're working on people's faces all day. Like, it's a more stressful job when you think of it from that angle. So just having for me, I just always want to have the best of the best tools in my practice so that I can just sleep warm and fuzzy at night, knowing like, hey, my patient got the best possible treatment they could have gotten. They know exactly what they're doing. Like, all of our bases are fully covered.
Very nice. Thank you, Emily. We're getting a lot of questions around pricing, and we have some interest in learning more about SkinPen and our treatment kits and so forth. And I would just ask that you can contact me, and I'll direct you tomorrow morning. My email address is amcdonald@crownaesthetics.com, and I'll make sure that you get to the appropriate inside sales representative or one of our territory managers out in the field to get all of your questions answered. But they did want to learn a little bit more about your pricing strategy, Emily, and I know that we talked about that previously as well. What is SkinPen currently priced in your practice? And then talk about face, and then face and neck, and do you sell that as a package, or do you make sure that you have an upgrade price so that you're upselling once they're in the practice? Can you talk to us a little bit about that?
Yeah, so first I did want to just put in a little plug. The skin pen is like the smallest, least expensive device you can buy for your practice when you're comparing it to other devices that yield similar results. So you really are getting the most bang for your buck and getting your return on investment extremely fast with SkinPen. I will say I got my return on investment the quickest with SkinPen out of any device I've ever purchased for my practice. As far as my pricing goes, I am charging $350 for the face and an additional $150 for adding on the neck. So I'm at $500. So I actually offer a membership program in my practice where my members receive 10% off. So I will do that. If I'm ever running package pricing, it is a special. And typically that's anywhere from 10 to 15% off. So I would say if you have a membership, incorporating SkinPen treatments into your membership is amazing. My patients have absolutely loved that, and it has definitely sold a lot more treatments for me. And then if you are doing package pricing, aside from sales, I would say doing somewhere around like 10 to 15% off. I will say if someone is adding on the neck, it is cheaper. Like doing face and neck is cheaper than just coming in and doing neck alone. Like, so the neck add-on is $150, but if they were to come in and only get the neck done, it would be $300 just to treat their neck. So I think pricing strategically to where it makes sense for them to do multiple areas at once instead of coming in two separate times and adding some type of a discount in. Because like we mentioned earlier, adding the neck, it's only adding 5 to 10 minutes onto your treatment because the patient is already in the room, prepped, ready to go. You're already explaining everything. So that would be my strategy for pricing, is just if you're doing add-on areas, have the add-on areas be cheaper when it's same day versus 2 different days.
Very nice. Well, I'm sure they found that very helpful. We got a lot of questions around that. So Emily, we are drawing to a close here, and I want to thank everyone. We had an extraordinary response to this webinar, and we had a lot of attendees tonight. I want to thank you all for sharing your evening with us, assuming that you're in an evening time zone right now. And this will conclude our webinar. We got a lot of great questions. We've had people behind the scenes trying to type in where we could. Again, I'll remind you that if it's off-label, if it's not acne scars or neck wrinkles for SkinPen, then please send those questions to medinfo@crownaesthetics.com. If it is PRP related, I would say just send all of those messages to me. I can make sure you get to the right person. That's amcdonald@crownaesthetics.com. We do have an inside sales department that is sitting, on the lines all day while your territory managers are out in the field working with practices. So you can call our 888-372-3982 main line. You can find all this on our skinpen.com website as well. You can also fill out a web form on our SkinPen website. So many ways in which to reach us to learn more and to answer more questions. We're here for you. And Emily, just want to thank you so much, not only for the time that you've provided us tonight and sharing all of this important information with everyone who attended this evening, but just the remarkable work that you're doing out in the field as well. Is there anything that you'd like to say as we end tonight?
Yes, no, thank you guys so much. I appreciate you so much. Thank you all for tuning in. If you do have additional questions, feel free to message me. My Instagram is Emily Frost Aesthetics. And I just am so thankful to the Crown Aesthetics team as well. It's amazing.
Thank you. And we are excited to partner with you. And any of you who would like to be partners of ours, or your current partner and you need information, we just get some questions about that of, how do I get access to that marketing portal or the e-learning? Give us a call. We want to make sure that you are connected to all of our important resources. That's part of the value that we bring to your practices. So thank you, everyone. This concludes our webinar for tonight, and we hope to talk to you again soon. Thank you, Emily.
Thank you.